Bring your hands so that you can touch your pinky fingertips together. So you can put your elbows down on the floor beside you and just have the hands kind of in front of your abdomen. And you're going to touch your right and left pinky fingertips together, only the pinky fingertips. So guys, if you see people aren't understanding, just go show. So just this. Yeah. Don't let any other part of the hand touch except for the pinky fingertips. So right pinky fingertip and left pinky fingertip touch together. And go ahead and let the eyes close again, so then you can use your eye bag if you want to. So when we do mudras, it's basically we're touching different fingers and parts of the hand together. I like to think of it almost like tuning a radio to a specific radio station. Now we have all these different radio stations that give us different types of music. When we do mudras, we're trying to tune into a specific place in the body. Notice in your body, and Tony, could you support Michelle's elbows a bit with something soft? Maybe a pillow from the sofa or something if you need two things. Notice where your breath feels the most full and apparent in your torso as you touch just the pinky fingertips together. And you might need to take a little bit of a deeper breath in order to feel something, so that's fine. Just kind of take a nice deep breath in through the nose. Where does the fullest sort of expansion start to happen with that breath in? And if someone could also support Art's elbows, so anyone's elbows that aren't on the ground, just so they can relax their arms. And then change the pinkies to the ring fingers. So separate the pinkies and touch just the tip of the ring fingers together. So just the pad. Some of you are going a little more to the side, so really just the pad of the fingers, yeah. And the other hand, part of the hand can be straight, or if you can curl it if you need to. So whatever you need to do to make it comfortable. And I'm going to ask the same question. Where does the breath seem the fullest in the torso? So from the floor of the pelvis all the way up to the throat. Do you notice movement and fullness in the inhalation? And if you don't feel anything, don't worry. And then let the ring fingers separate. And you're going to do the same with the middle fingertips. Just pressing very gently those middle fingertips together and noticing if you sense a difference in the breath, in the location of the breath. Have we tuned the radio to a different station? And then let those separate and touch the index fingertips together. Does the breath shift? Stay really aware of what sensations are coming from the body. And good. And then lastly, just the thumbs, the tip of the thumb. And where do you feel your breath move in the body? Now the last one I want us to do is to put all 10 fingertips together. So thumb to thumb, index to index, middle to middle, ring to ring, and pinky to pinky. And as if you were holding on to a round object. So let your fingers be kind of round. And just feel the breath as you breathe in. Imagine that as you're breathing in, that the breath could go from the nose all the way down the length of your body, all the way down to the floor of your pelvis. You can imagine almost like you poured the breath into a glass. When you pour water into a glass, it fills it from the bottom, kind of goes down into the glass. So think about the breath kind of doing that same thing. And then as you exhale, imagine that the breath is like being, like water being drunk out of a straw. So it comes up from the base of the body, the floor of the pelvis. The exhale travels up through the belly, the lungs, the throat, and out through the nose. So inhale from nose to the base, all the way down the length of the spine. And exhale from the base back up to the throat and out the nose. And do that 3 more times, that image of the breath moving down on inhale and up on exhale.